So today I'd like to talk to you about The New Menopause by Dr. Mary Claire Haver. So this is a New York Times bestseller, and it's really understandable why. I'm sure many of you have heard of Dr. Mary Claire. She is just absolutely incredible. She's very knowledgeable, extremely good at explaining concepts, and has a massive presence on social media. She's very, very generous with her time. She creates a lot of content for her followers and is extremely good at just sort of making the point really succinctly so that people understand that she gets them, she sees them, she hears them. And her book is very, very similar. You can really almost hear her voice as you're reading it. And it really seems to be talking about a new approach and why we need to be approaching the menopause differently. I love that she goes even back as far and gives us a little bit of history. She tells us that the word menopause was coined back in 1821 by a French physician called Charles Pierre Louis de Gardin. And basically, it was a mashup of or month and related to the moon, and pause and stopping. So literally the end of the monthly cycle. Clearly, menopause existed long before 1821, and apparently it caused both early Greek and Roman physicians great confusion. They believed that actually a monthly period was a way that toxins and poisons were released from the body on a monthly basis, and they therefore also believed that if a woman reached menopause and they stopped purging these poisons and toxins, that it was clearly very dangerous, and they believed that it caused women to go mad. And menopausal madness treatments varied from the wacky to the inhumane, including leeches and mental asylums. Now, a number of my patients will often joke and chat to me and say they think they've got the menopausal madness. But the reality is, it seems that, we've known for centuries that women can develop lots of mental health symptoms and many other symptoms from this time of life. And yet, over the last sort of 25 years, it's like it's all been sort of brushed under the rug. And the great thing is that physicians like Dr. Mary Claire have really brought this conversation to the fore again. So anyway, back to the book. After we navigate a little bit of the history of the menopause, then she really takes us on a bit of a journey, talking us through all the symptoms. She works us through all the definitions, which again, you come away feeling really, even as a doctor, that you understand it better. So this is definitely a great book, both for medical professionals, but absolutely for laywomen as well, and men, of course. The book shares a number of personal anecdotes that she has shared from her patients and their experiences of going through the peri and menopause. And I think that's really helpful as well, because you can definitely hear yourself or feel things that you've gone through just reading this book. I also wanted just to read an anecdote that she shared from a pharmacist, and I think it does explain what happened to our generation of doctors and health professionals and even pharmacists, and why HRT went off the table for such a long time. So I'm just going to read a little excerpt from the book, and it's from a pharmacist called KTG, and it says, "I'm a clinical pharmacist who started my career just before the WHI was published. At the time, doctors refused to start HRT or stop women from taking HRT, and patients were saying, 'Don't you dare take my hormones away.' I couldn't comprehend why they were so vehemently against stopping. Now I understand. The little things I couldn't connect as perimenopause in my late 40s, I now know were all related. I was having anxiety and irritability that was way out of proportion to situations. I had hot flashes and insomnia for months without a break, which would wake me between 3 and 5 a.m. each morning and cause fatigue, daytime irritability, brain fog. I experienced joint pain, palpitations, sweating through clothes, and was uncomfortably hot all the time. I came to my last obs and gynae visit ready to argue for HRT. I was relieved when she said, 'Let me help you.' I still need a dose increase, but I definitely see improvement. Don't you dare take my HRT away." I have to say, I absolutely understand what this pharmacist is saying because I did my training in the same era. So when I was a very junior doctor, we were still prescribing hormone replacement therapy. And then suddenly we got to 2002 and it all pretty much stopped really overnight. And I have to say, there were a few real warrior women who I look back and say what they were amazing because they did argue back and they refused to give up their HRT despite being put on under huge pressure by medical professionals. Anyway, throughout the book, you will read lots of anecdotes from various women and family members explaining, how they've experienced their menopause. And Marie Claire is very good at interspersing these through the book just to break it up and also keep you engaged because I'm sure you will read parts that you just feel like, well, that's me. Another really interesting part of the book, which I absolutely love, is she dedicates a whole section to who should not use MHT or HRT. And she explains who the patients are who shouldn't be having menopausal hormone therapy. And she says, you should not use menopausal hormone therapy if the following safety concerns are present. You've got undiagnosed abnormal genital bleeding. You have known or suspected breast cancer or other estrogen-sensitive cancers. You have an active or recent arterial thromboembolic disease or clotting, and you have an active or recent venous thromboembolic disease. You are known or suspect that you're pregnant. You have active severe liver disease or dysfunction, and you have hypersensitivity to any of the components of hormone replacement therapy. She also then debunks a lot of the myths around hormone replacement therapy. So a lot of women will come in to me and say things like, oh, I've got endometriosis. That means that I can't have HRT. But that's false. She also debunks the myth around adenomyosis, which is also not a preclusion to HRT. A family history of heart disease, liver disease, or breast cancer automatically excludes you from MHT. Again, this is false. Concerned over an increased risk of clotting should automatically exclude you from MHT. Again, she explains why this is false. And a history of migraine. Again, another really common reason that women will believe that they can't have HRT. And she explains why this is also false. So it's a great book to actually debunk a lot of myths. The book also explains what blood tests you should have and why. And then the final part of the book is fantastic because it really covers in depth a menopause toolkit, and it goes through every possible symptom that you can think of and then some that you haven't even thought of. So she goes through everything from body odor to brain fog to brittle nails to chronic fatigue, frozen shoulder, insulin resistant, fatty liver disease, supplements, sexual dysfunction, sleep problems, vertigo, and many, many more. And she tells you all the evidence there is in a really succinct and readable way. There are also fantastic sections on weight gain during the perimenopause and menopause and how to manage it, supplements, and relationship issues, irritable bowel syndrome, just to name a few. One of the things that I love that she concludes is the statement by the North American Menopause Society, who are now called the Menopause Society, and they issued this statement in 2022, which I believe should reassure many people. And they said, and I quote, the 2022 hormone therapy position statement of the North American Menopause Society, with the consensus being that for healthy people born female, younger than 60, and within 10 years of menopause onset, the benefits of hormone therapy outweigh the risks. This update was a significant rewrite of their prior recommendations, which said that MHT was recommended only for severe symptoms and at the lowest dose for the shortest time. Unfortunately, many doctors still quote the lowest dose for the shortest time, but that's actually not what the recommendations are anymore. And in 2020, the American Heart Association publicized Menopause Transition and Cardiovascular Disease Risk Implications for Timing of Early Prevention. The statement acknowledged the accelerated increase in cardiovascular risk brought about by the menopausal transition and emphasized the importance of early intervention strategies to help reduce this risk. The findings noted that those who are treated with hormone therapy, along with a comprehensive nutrition and lifestyle approach, have lower cardiovascular risks and less likelihoods of negative disease outcomes. I think it's really important that we know that these societies, who are really well considered and well thought of, have come out with these really firm statements, because the reality is that many people still are looking to old literature. I absolutely love this book, and I know that you are too. It is such a good read. It's easy to read. It really resonates, and there's definitely stuff that you're going to find really relatable, but you're also going to find little anecdotes and bits of information that you'd never even thought of. The toolkit is amazing. I found it really, really helpful, and even as a doctor, I learned a lot. So I really recommend the book. I've linked it in the show notes below if you want to purchase. I'd also love to know if you've read this book and enjoyed it, and what was your favorite part. And if you've any other books that you'd recommend or like me to chat about on the podcast, please comment below. On Sunday morning, when I was out walking at Terrigal Beach, which is a local beach, I kept crossing paths with a number of women who all had vests on, just like me, weighted vests. And we all gave each other a bit of a knowing look, because these have become very, very popular in peri and postmenopausal women. You might not know what rucking is, but basically what it is walking with either a weighted vest or a weighted RUKSAK. I personally opt for the weighted vest because I find it very, very comfortable and very, very quick to put on. So for peri and postmenopausal women, there are definitely a number of health benefits that you can gain from walking with extra weight. One of the health concerns that many women have at this stage of life is developing heart disease. And unfortunately, we know in the postmenopause, the rates of heart disease for women really start to accelerate. So why might rucking or walking with weight change that? Well, basically, whenever you're walking with additional weight, it increases your heart rate more, and it basically makes your heart exercise a little bit harder. So hopefully making your heart a lot more healthy. So that's one of the benefits of rucking in comparison to standard walking. So if you're intrigued and ready to start rucking, my recommendation would be that you start low and go slow. So start by choosing a weight that is 5 to 10% of your body weight at maximum, and take it slowly. Go for maybe a 10 to 20 minute walk at first. Don't decide to go on a 5-hour hike the first time you strap on your weighted vest. So we've been chatting to our friends at RUKSAK, and I've got a special discount code for you. So if you go to their website, which is www.ruksak.com, so RUKSAK.com, and use the code SHAUNA15, so that's SHAUNA 15, you're going to get a 15% discount. So whether you decide to go for a vest or whether you decide to go for one of their backpacks, either way, you're going to get 15% off. This podcast and any information, advice, opinions, or statements within it do not constitute medical, healthcare, or other professional advice. Information is provided for educational and entertainment purposes only. If you have any health concerns, always consult your doctor.